Yeah.
Hi, is it Chad Bratterson?
Hi.
Oh, yes. Yep. Okay.
Yeah, it's Chad.
Chad
Bratterson, but my friends call me Team Money. You can
Money.
call me one of those.
Oh, okay. I'll call you Chad or
And
Mr.
Team Money.
Bratterson. Okay. So, what seems to have brought you in today?
Oh man, I have this cough, you know.
Mm-hmm.
It's been going on my whole life though.
Okay. Yeah, I see. We have coughs, shortness of breath. Feel like you can't catch your breath.
Yeah. It's been a lot worse lately.
It's been going on. So you said you've always kind of been a coffee person, but it's been worse lately. What?
Yeah.
You know what made it worse recently?
I'm not gonna lie. I mean, probably the cigs.
The cigs. Okay, so like.
Maybe. I don't really know.
Yeah,
Not a
yeah,
scientist.
Yeah, you're that's my job. And smoking cigarettes. How many cigarettes would you say you smoke?
Oh, just like
Per day or per week?
per day.
Yeah.
Maybe like a pack or so. But it really, the weekends.
Weekends.
Well, you know, a drunk cig ain't a cig.
Yes.
You know?
Okay, I've heard that.
So, I don't really know. The weekends don't count then.
Okay.
But the cig wheel.
The cig.
The cig wheel, that was this weekend. So that's what's really been getting me going.
Okay, cig wheel. Okay.
Mm-hmm.
So I'm not sure how many cigarettes that is, but
Well, it's just all the bros. We all do it.
Oh, okay. All right.
All my brothers.
What does your diet look like?
What do you mean? I mean, mainly just Taco Bell.
Okay, Taco Bell. Do
Taco
you eat
Bell,
any like
chips,
produce, fruits,
what's that?
vegetables?
Just Taco Bell.
Just Taco Bell. They've got some
Sometimes Chick-fil-A.
Oh, okay.
Yeah.
Okay.
Not the salads.
All right. And so, kind of talked about your symptoms. What made it worse? Taco Bell. Your social. As far as your social history, how much would you say? Well, do you drink alcohol?
Well, you know what they say. It ain't alcoholism if it's college.
Okay. Yes. So, how much alcohol would you say you drink in college? Like per week?
Per week? Like a bog or two.
Okay.
You know what that is, man?
Like the gallon thingy?
Yeah.
Oh, okay. Okay, so what per
I mean,
day?
that's pretty normal. I drink less than the rest of them. No, like a few a week.
A few a week. Okay.
Yeah.
Few a week. Okay, we'll come back to that alcohol later as well. And then real quick, can I get your family history? So your parents have any diseases at all?
Yeah, my dad has COPD. COPD? COPD.
COPD?
Yeah, I got it right. But I don't really know. He's just been coughing his whole life, but like he smokes too, so.
Okay.
But
Gotcha.
he's had it since he was young, like college years, just like me.
Really?
Well, I mean, I've
still-
had it for a long time.
Yeah, but he got all that coughing and everything while he was in college too?
Yeah, but he smokes, so.
Okay.
I don't
All
know.
right.
But my mom, I don't know. She's got something. I don't really know.
Okay. All right. And then anyone else with any like respiratory issues like this?
My parents. I think my dog Millie.
Okay, Millie. Okay. Well, okay, I got that written down.
Yeah.
So, all in all, I think
Bless her soul.
I'm pretty concerned for some lung issues, so I'm going to order kind of a whole workup. We're going to do a CBC and CMP, which are blood tests, a chest x-ray to see what's going on in those lungs, and based on that, we might do a CT as well, which is more in depth. And then we're going to get what's called an A1AT genotype, phenotype, and serum level. And we're going to put you under some pulmonary function testing, PFT.
Man, I don't understand a word coming out of your mouth.
Well, here's what we're going to do. We're going to order a bunch of stuff. You're going to do it all, and then I'll come back to you with the results, okay?
Okay.
All right, sounds good. I'll be
Good
back.
stock.
I'll be back, T-Money.
Bye-bye.
Ring, ring.
Hello?
Hey, is this Graylee?
Yes.
I was just hoping you had the results back for all the tests and labs I ordered.
Oh, yes, I do. So it looks like the phenotype and genotype came back and shows a severe alpha-1 antitrypsin deficiency. The serum level is below 57. The PFTs show an obstructive pattern, and the CBC is normal. CMP shows a GGT elevation, and then ST-ALT ratio is 2:1. And then the chest x-ray shows low flat diaphragm, hyperinflation, and then increased basilar radiolucency.
Golf Bleb. Okay. Hi, Dr. Bleb. I was just calling to consult about a new patient I have. He's a 21-year-old male and just tested positive for alpha-1 antitrypsin with the phenotype ZZ, so it's pretty severe. He's a pretty heavy smoker. When is the soonest I can get him in to see you?
So I'm booking out until 2032, but in the meantime, we can get some things started.
Okay, 2032. So yeah, what can I get started for the next 8 years?
So, because the serum level's below 57, we can replace that alpha-1 with weekly infusions, but make sure you really hammer home the smoking cessation and the importance of his diet. You can also do a lava llama, maybe a sama for exacerbations. You know, you have the option of pulmonary rehab, and
Yeah, okay, perfect. Well, I'll get him started on that stuff and set him up for that 2032 appointment.
okay, I'll see him when I see him.
Okay, thank you, bye.
Hey,
Hi, T-Money. So
yeah, what's up?
we're getting some results back. Still working on diagnosis. I'm gonna do the rest of my physical exam that I definitely did earlier, and make sure that it all lines up. So
Yeah.
just gonna
That means
listen
you
to
gotta
your
touch me?
lungs. Yep, and I will put you in a gown and everything for this.
Oh, okay.
Could you take a deep breath? Okay. Could you try and take a deep breath through your nose? Okay. And then try again. Okay. Definitely some wheezing hurts. So this is all lining up with the test results.
Do you notice my chest though? I've been hitting the gym lately.
Okay.
Been looking pretty big.
Yes, so
Let's see
this
some of
this enlargement of the chest, like this way,
Yeah.
we call it barrel chest. It's a sign that your lungs are kind of hyperinflated and too big.
I've just been hitting the gym too much, honey.
Okay. Well, so this all lines up with and confirms my diagnosis. It's a genetic disease called alpha-1 antitrypsin disorder.
Yeah.
And so let me actually just cut to our pathophys girl to explain what's going on in that disease.
Okay.
Okay, so in a normal healthy patient, we have DNA that tells our liver to make something called alpha-1 antitrypsin, which is a protein that protects the lungs from our big bad neutrophil elastase here. So in healthy lungs, this isn't present and they look great. In damaged lungs, so we don't have production of this because of a genetic mutation, we have a buildup of neutrophil elastase, which then damages the lungs. And we see liver damage because it's all accumulating and can't get out of the liver.
All right. So, T-Money, did you have any questions about that? You feel like you understand what's going on?
Yeah.
Okay, good. So as far as treatment goes, the first and most important thing is going to be that we stop all smoking. So no more cigarettes.
Well, I can vape then.
No, we actually prefer, no nicotine, nothing, no inhaled drugs of any sort, because we want to keep your lungs as healthy as possible.
Okay.
Okay, so we can do some smoking cessation coaching in a bit. We also have to stop drinking alcohol because your liver is already at risk with this A1AT. And then you're gonna get weekly infusions to give your body back the thing that it needs, that A1AT that's lacking. So do you have a car that you can get to weekly infusions
Nah.
with? No. Do you have any friends or
Oh,
roommates?
been waiting for you to ask that one, honey. I'm in the frat.
Oh, okay.
Delta, Omega, Chi Phi.
Good. You bring that flag with you everywhere?
Yeah, I do. I gotta support. I gotta show up for my brothers. Homies for life.
Yeah.
Brothers for life. They'll always,
Sounds
they're
like,
there for me.
sounds like they'll support you by bringing you to your
Yeah,
infusions.
they got me.
Okay.
Don't worry about it.
Good. All right, and so we're also going to give you an inhaler to use, a lava llama, what we call it. It's got two components. You're going to use that once a day to kind of prevent things from getting worse. And if you do feel like things are getting worse, we'll give you a short-acting inhaler to use, like when you feel real short of breath in a short-term setting.
Makes sense.
And last but not least is diet. We need to make sure that you are eating a better diet. So we can refer you to a dietitian. Do you have anyone that could support
Well,
you?
you know what? We got chef back at the house.
Oh.
Little Jimmy.
Okay.
I call him Big J. So
Yeah. Okay. Well, maybe
he's Big
Jimmy-
J in my heart.
Maybe we can work with Jimmy on getting you some fruits and vegetables and more than just Taco Bell, all right?
Yeah.
Okay, I know. Big adjustment, but this is really important. And then we also do need to talk about whenever you're ready to have kids or anything, we're going to talk about, how this genetic disease could be passed on to them. But
I better
you're not
talk
there
to my
yet.
baby mom.
Oh, okay. All right.